I'm originally a psychologist, but what I'm going to talk about is much more about the recovery model, how it works, sort of the experience and the psychological side, and much more focused on the issues for those people who are in leadership positions within organisations, the tensions and the trade-offs to do with the context in which people work in. And the research that Jed referred to was that I previously ran something called the Whitehall Innovation Hub, which was promptly closed down at the end of the last government. And we were looking for an example of a service innovation where people were really serious about putting it into practice. In other words, all the arguments with policymakers looked like they'd been won. And it seemed like the recovery and implementation recovery actually provided that, that example. And so we made contact with the Sainsbury's Mental Health Network and Jed and Julie and other people, and did a very quick and dirty piece of research, really, in research terms. That's how it would be described. That doesn't actually undermine it, I don't think. And worked with two particular trusts. I don't really want to go into too much detail about them. One was St George's and the other was Devon Partnership, and they were very, very different. And what we spent most time talking to people about was how far the trust management were managing to put into practice the things that they thought they were putting into practice and what were the issues. And it was very interesting because it demonstrated how different places are, and how you can't avoid context. You can't avoid which sort of people are the champions for a change process, and their strengths and weaknesses. And I think these two trusts really, they were both, the process was led by very committed people. Glenn Roberts in Devon Partnership, and they had a very, very strong user network, and networking between professionals and practitioners and with patients was very strong. And the context in St George's was really quite different, where they had a much, much more systematic approach to assessment, specific ways of organising, and in many ways were better at demonstrating impact than they were in Devon. And actually, if you put them together, they would have been an incredibly powerful force, I think. The three areas that I think were key. One was the serious ability of the leadership level, whether it would be the chief executive, the board, or somebody who's a director level. It's the people who are driving the process. How did they conceive of leadership, and what did they think they should do? And throughout the public sector, we talk about transformational leadership, but we actually don't talk very much about what that really looks like. And that if there are certain things that it became very clear in government that was the case as well. So everybody started going to seminars on being transformational, right? And everybody went away feeling, I'm very transformational. And I've read all these books, and I've Googled everything that I know to talk about, having a vision. And at the time, that's what everybody did. But one of the key things that was clear in relation to this recovery process is that it was great if you had a transformational leader and could talk, but it was absolutely useless if they didn't have any sense of their role in follow-through. And if they didn't actually recognise that they had to be instrumental in changing the system that they oversaw, rather than trying to squeeze recovery into existing practices. And those chief executives, in my experience over the years of having worked on public leadership, where people really make a difference, is that they have an ability to recognise who they need around them, to pay attention to internal problems as well as external ones. So there are lots of people who are now becoming brilliant at external networking and partnerships, and actually have no idea what's going on in their own backyard. And we've quite a lot of think tanks like that as well, where we have really impressive, big speakers and who are big thinkers. And then behind them, they have an army of people who are still behaving in the same way in which they were 20 years ago. And that is a really big problem. And so there's something about talking the language of the changes that you want to make and why, and having a narrative. And that where that happens, then people are galvanised with a sort of energy to think, oh, they're really serious. And that means working with your HR department in a way, not leaving it to them, but telling them what's expected, such that the incentives that are put in place in terms of recruitment, appraisal, etc., and supervision work. Because, especially those of us who've been involved in education, we do advocate quite a lot of training. And those people who want to, develop their careers, pick up lots of training. But actually, they often find, like women managers did in the 80s, you have lots and lots of training, and then you go back to your organisation, nobody around you really wants to take much notice of these things that you've just learned. You get very frustrated and you leave. And that's still quite a common process. And there is research that shows that supervision is twice as important as ad hoc training. So you stimulate people with training, give them new perspectives, but if you want to train practice, you have to look at whether or not the people who really can talk to people in a human way and have empathy, are they taken seriously? There are lots of people in the whole area who work at the front line at the moment in areas of mental health, crime, substance misuse, who actually are they're not great at paperwork. They're not the people who've got the best degrees. And some of them are being praised as being very, very poor at their work. But actually, they have worked with individuals and organised things that make a difference to their lives, like going fishing, taking them somewhere different, and thinking creatively about what's really going to make a difference, to this person. Some of those people are not just not being rewarded, they're actually being sacked. I mean, this is not an exaggeration. I've got two people in mind, and I'm not saying they work, one of them does work for a mental health trust, the other one works for a housing association, and I've heard other people say this as well. We need to connect our ambition at being more empathetic and capable of working with people to the systems that we have in place in terms of developing the workforce, and that does not happen at the moment. And if you it's hard, this stuff. It's not easy, and it means attention to a sort of detail as a leader or somebody you trust paying attention to detail in your HR department, and an equivalent focus in other corporate services. But HR is particularly important, or the context where you talk about performance management and the development of staff capacity, within your context. And I think one of the things that's happened, and this is not a criticism at all, but one of the things that we sort of observed in relation to the recovery approach is that if you're a clinician, the sort of legacy is the sort of discussion is around your medical model. We don't want a medical model more, we want this sort of model. Whereas back in the backyard, in terms of the daily working relationships, are people who the model really is completely irrelevant. It's actually how many hours they work, what they're expected to do, whether they're measured on tasks that they do or the quality of their relationships, and how do we change performance management as well as evaluation, but performance management in particular, to value the relationships that we're all saying now matter. And that actually undermined the lack of that ability to be able to have a confidence that we are rewarding the things that make a difference to behaviour change and quality of life for all service users are not the things that we're necessarily rewarding, especially for people at the front line. And how many people say in relation to care, this has nothing to do with mental health, that that what they want is consistency and a focus on them. And whether you're somebody who's a young person who's going through a breakdown, or somebody who's 90 who feels like they're going to break down physically, you want respect and attention from the person that you're talking to, and that's worth much more than anything else. And we are really bad at measuring it, and that's so it's getting into that detail in terms of how the organisation actually works. And the thing about networks, although it's difficult, that it's it's not so easy to measure, is that sometimes that reinforcement for people is happening inadvertently in a way that we're not planning for, but it's happening because you've organised a network. And if we only have not system now, but if we spend so much time just looking at very precise forms of evaluation, whether it's of a project or of an individual, we're undermining the very things that we think we want to encourage. And there's a great book, I don't go around promoting people's books much, but called, I think it's called Ubiquity by John Kay. I think it's called, yes, it's got this rather sort of oblique title. It's a really good book. It was written in frustration at the end of the last government about consequences of very, very narrow targeting in terms of programmes, and that most innovation, whether it's the innovation of recovery or implement, it does not work because you planned it this way. You know, things always are messy, and so the innovation journey, if you like, for individuals is messy. People, what you expect to make a difference often doesn't. And so things have to be open, where you sort of have a confidence that this person is humane, respects people, and allow things to flow. And then we have to differentiate between the journey of the individual, if you like, in terms of how you're conceiving of better care for a person, from the organisational journey. Does that make sense? Because at the moment they're very, very confused. We're just talking generally about changing culture. So we need to focus on what's the journey for a particular partnership in a context, and what does that involve? That actually does involve changing practices and processes, and how do they match? Are they reinforcing the sort of journey that you want in terms of the holistic journey for the individuals? And I think it would help to differentiate between these different sorts of journeys and have a focus on it, and it will help those people in leadership positions to understand that they've got their own journey, that nothing happens overnight, and that we need to stop having a period where, ImROC has, 2 years. The Change Centre was in operation for 5 years in the business school, which I ran. We then had an innovation hub in government that ran for 3 years, and then that stops. And we're undermining so much by allowing policymakers and practitioners to not connect things that other people did, if that makes sense, because everything gets renamed. And the good thing, I think, about the recovery process is that there has been more, connectivity, but it's still the case that it gets slightly renamed. You've now got a network. Previously, there was the ImROC. Well, there still is, isn't there? And then there's a constant undermining, but actually of developing relationships, and it's continuity that really makes a difference.